Ring ring.
Hello.
Hi, this is Mary with Washington SHIBA. We help people with Medicare. Is this Kathy?
Yes, this is Kathy.
Hi, Kathy. I received a message that you were approved for a Medicare savings program. How can I help you?
Oh, great. My Premier plan that I had for the past few years was not available for this year, so I got a new plan. Then last month I went to my doctor and he decided he wanted to make some changes to my prescriptions. So I called my pharmacy to see how much my medications were going to be, and they were going to be really, really expensive. So I wasn't going to be able to afford them without using my emergency savings. So my neighbor suggested I call SHIBA. So I called for some help, and Elise explained Medicare savings programs to me. So I applied. And she told me once I received a letter that I was approved or declined to call back, and somebody would help me figure out what I can do. So I got the letter saying I was approved for qualified Medicare beneficiary effective the 1st of next month. So I'm calling back.
Well, that's good news that you were approved for a qualified Medicare beneficiary or a QMB. It will save you a lot of money because you will get the amount of your Part B premiums back in your check, and you will no longer have to pay for the cost of Medicare services beyond what Medicare pays and have lower prescription costs because you also will have extra help. You can get a Medicare Advantage plan like your Premier or current plan, but with more benefits, or have original Medicare and a separate Part D plan with these benefits. Did Elise explain to you how that works?
She kind of did, but she said we would talk more about it when we knew what options I would have.
All right, so aside from your medical care and prescription costs, what is most important to you?
Well, I want to be able to stay with my primary care doctor and need dental coverage. I went to the dentist not long ago, and it appears I'm going to need a root canal and a new crown, which is a big deal and quite expensive. And the dentist's office told me it would cost over $1,000 even with my insurance. I guess my new plan wasn't going to cover that very well either. And I suspect that I'll probably need some other dental work done as well.
So, dental coverage is a big concern for you.
Yes, it is.
Okay, so we're definitely going to want to look at Medicare Advantage plans for you, particularly dual eligible special need plans that have more benefits than the regular Medicare Advantage plans you have had. As we go on, you might hear me call those D-SNP plans.
Okay.
So just like the Medicare Advantage plans you have had, these plans include all of your Medicare benefits, and the plans available to you depend on your Medicare savings program level and where you live. So where do you live?
I live in Spokane.
And what is your zip code?
It is 99203.
Great, thank you. Have you received your letter from Social Security that you've been approved for extra help yet?
Yes, I did.
Great. As you know, your new assistance means you have new options for Medicare coverage. So I'm going into the Medicare Plan Finder on the Medicare website. You might be familiar with this. Did you have help getting your new plan for this year after your Premier plan ended?
My neighbor helped me.
It sounds like you have a good neighbor.
I do.
So what we're going to do next is enter your prescriptions into the Medicare Plan Finder. Do you know if your neighbor did that when she helped you?
I'm not sure. I know she put my information into a program on her computer.
Okay, well, the Medicare Plan Finder allows us to see how all of the plans available to you will cover your prescriptions, and it ranks them by cost because that is a key part of Medicare coverage. So, do you happen to have your information on your prescriptions available?
I do.
Okay, I'll go ahead and enter those into the Plan Finder. I have all of your plan options pulled up on the Medicare Plan Finder now, so I'm going to look at the special needs plans, those D-SNP plans I mentioned earlier, to see how those compare. To do this, I'm going to switch to a chart with information on special needs or on the special needs plans. There are a bunch of these in Spokane County, but only some that are designed for people who have QMB benefits. So if you can bear with me, I'm going to edit the chart so I'm only looking at those that are relevant for you.
Okay, thank you.
So one of the big changes for you with QMB is that you can no longer be charged for Medicare covered services. That means you will not have copays for the services that are covered by Medicare Part A or Part B, like hospital stays, physical therapy, specialist visits, appointments, or medical equipment. This is incorporated into all of these plans. They also have $0 premiums, and some have no cost sharing for their covered prescriptions, meaning you could have no co-pays for your medications.
That's just fantastic.
It is, but it's important to remember that it does not apply to services that are not covered by Medicare, including dental, vision, hearing, and fitness benefits. So those costs for the services can vary. Okay, so I'm seeing a total of about 10 plans designed for people with QMB available to you. There are not many differences for the medical or prescription costs, so I think it would be good to look at other factors. You said that you're expecting to have high dental needs, right?
Yes, that's right.
So I think for your situation, it would be good to focus on plans with more dental coverage. One company called Community Healthcare Community Health Plan of Washington only offers up to $750 in dental care. Other plans offer more. Are you comfortable with me eliminating this plan from the list of possibilities at what we're looking at just because their dental benefits are so low?
Yes, I think that's a good idea.
Okay, so the first thing you need to do is ensure any medical providers you want to keep are in network with the plan that you choose. You mentioned that you had Primera, so you had to get a new plan this year. Did you happen to talk to your doctor's office and find out which companies that they are in network with for when you were changing plans?
Well, they told me they are in network with most companies, but do not take well care.
Okay. Some of the plans that are on our list are well care plans too. You mentioned you want to keep the same doctor. Should I remove those plans as well?
Yes, that's fine.
Okay, and then is there anything else that's of a concern to you? You mentioned your dental work. Do you want to keep the same dentist?
Yes, if I can, but there are a few other dentists I am comfortable with, so it is more important that my insurance covers as much as of it as possible. So I might be willing to switch, except to Molina. My neighbor who was helping me had Molina, and she could not find a dentist in network within 100 miles. So she ended up having to pay out of all her medical, or excuse me, all her dental work herself. So no Molina.
Okay, so we'll take Melina off the list. That leaves us with three plans.